I was about to return to school for my second semester after holiday cheer filled the air, and I had a great experience reuniting with all my family and friends. And on January 11th, my friend Ryan Patrick O'Shea leaned into a train taking his own life. I saw him the night before, and I came home to the news the next morning. I slept out at my college roommate's house. And when I came home, my mom was on bed rest due to breast cancer. And one of my best friend's moms broke the news that this tragedy had occurred. And immediately my friends and I got together and we were in complete and utter shock. Every day, it's an ongoing healing process. And fortunately, I'm surrounded by so many people I love. I have a significant support system, not even within my family and friend group, but within my community as a whole. And I'm very fortunate that I was able to find ways to cope and go on with my life, although Ryan is no longer here. I definitely think about him every day and wish he was here. But luckily, I share the memories I had with him with my family and friends, and I'll never forget my relationship with him.
It's stories like Gianna's that are common all across the country. In 2019, my hometown was shaken with tragedy. After Ryan, just a short 2 months later, we lost another teen to suicide, this time a high school student. In meeting with the school administration, it became apparent that there was a real need to connect students with mental health care beyond the scope of what the school can and even should be providing. In January of 2020, we opened our first behavioral health center in partnership with 5 local school districts, and it couldn't have come at a better time. The Cohen Children's Northwell Health Behavioral Health Partnership was developed to address the escalating need and concerning gap that was brought to us by the school administration and their clinical teams. As a parent of 4 children, I'm so grateful that we've developed this resource, and all I want other parents to know is there is a place to go, there is a place to get help.
Before the pandemic, we also had issues with mental health. This is not new. Even before, we had about 20% of children being diagnosed with various mental health issues. The American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics, and the Children's Hospital Association called for a national pediatric mental health emergency due to the rising numbers that we are all seeing across the country. Our school-based mental health program currently partners with 17 school districts. We work together with them to provide care to their student body and communities. And we also collaborate with them to provide education, professional development, to provide the best care to the students. I want students like Ryan to know that we are here for them, we are here in their community, we're here when they have a crisis, and that we're here to help.
The Northwell Health Behavioral Clinic partnership is really amazing, and having this partnership really normalizes the need to seek mental health supports. It is really critical for our families, and creating this partnership and this ease of access for our families is a game changer. We facilitate it, we kind of hold their hand and work with them to facilitate the appointment, and then we hand them over to Northwell Health, and we know that they're embraced here, they're supported here, and that environment is really critical for families. So this really facilitates that supportive and welcoming environment and normalizes that mental health services are a part of our society just like any other medical service, and our families and our students need that today.
My healing process is ongoing. Every summer, we celebrate his legacy at the Ryan Patrick O'Shea fundraiser. It is a bittersweet weekend that celebrates the life of my friend and reminds our community of the need for appropriate mental health services. My mission in pursuing a career in physical education and health is to spread awareness while educating our youth about this topic. Our society must grow to understand that it's okay to not be okay. Seeking out resources to get the help you need does not make you weak, it makes you human. I invite you to join me in ending the stigma and starting the dialogue. Together, we can save lives.